Thank you, everyone. Thank you, Mark. Good morning, everyone. My name is Shaima Hassan. So today's session, just to start off with, our ARC Northwest Coast collaboration is key, from sharing an idea to designing and delivering a research question to implementing or delivering a research project. So to give you a better insight of how you could share your ideas with ARC Northwest Coast, we have our ARC themes who will be giving examples and explaining the process of ideas to give you a better insight. So without further ado, I'll let Dave share some videos.
Good day, everyone. My name is Kimberly Lazo, and I am a research associate from the Implementation and Capacity Building team. In this video, I will briefly talk to you about how you and your organization can engage your research ideas with us and how we can support you in implementation. Do you have any research ideas that need support in implementation? Perhaps you have an intervention that you are developing or planning to roll out into the wider system, but you want to understand the readiness to change of the various settings you want to implement it in. Or maybe you have something which you are already using, but would like us to evaluate the way in which you have put it into practice and understand any barriers or enablers related to that. We are inviting you to present your ideas to the Implementation and Capacity Building team, otherwise known as IMPACT. We are one of the 3 cross-cutting themes in the ARC that offer methodological support. We particularly specialize in helping your organization embed, use, and apply implementation science in your research so we can understand the challenges and solutions associated in service delivery in health and care. Once you have presented your ideas to us, we will link you to the appropriate ARC themes. Once your research idea has been prioritized by our wider member organizations and public advisors, we will then work together to embed an implementation approach into your plans and think about any potential challenges, structures, resources, and mechanisms through which the delivery of the intervention can be achieved. Our support includes designing a research plan where we consider the most appropriate methodology for your intervention and the people who might need to be involved in the process. We can also support you in developing this plan into a proposal where we think about the evidence behind your intervention and how implementation can guide the rollout. Finally, we can support you in applying for an external funding, ensuring that there is a clear pathway to impact. Just a few examples of how you can work with us. We are currently working with a team of clinicians who initially discussed their ideas with PCCC theme. PCCC then linked that team to IMPACT after they identified that they needed guidance in creating an implementation plan. After the initial discussions with our implementation team on identifying the needs to move the project forward, the project has undergone the prioritization process within the ARC. Since then, we have been helping this group of clinicians to develop an NIHR grant application by linking with them with our strong networks of academics, implementation science experts, and the Lancashire Clinical Trials Unit. Another example of working with us is through our industry partners. Innovation Agency approached IMPACT to contribute to the development of their research pipeline work. We proactively engaged by attending meetings, participating in discussions, and providing concrete ways to link to the ARC Northwest Coast and Innovation Agency. Don't miss this great opportunity to learn, engage, and collaborate with us and have our wider access to the network of implementation experts. If you have research ideas and want to connect with us, please feel free to contact us using the email provided. Thank you very much, and we look forward to hearing from you.
Hello everyone, my name is Dr. Pallavi Pandey and I am the manager for the Health and Care Across the Life Course theme. Today I'm going to be talking to you about how a project came to the theme and how we intend to support it. This project is being led by paediatricians at Alday Hospital and revolves around neonatal admissions due to breastfeeding difficulties. The paediatricians are working alongside a psychologist at the University of Liverpool who introduced us to the group, and the first thing that we did was we asked the paediatricians basically to fill out a scoping form, and as well as a HIAT, which is a health inequalities assessment tool, which we could look at and decide how we can take this project forward. So just a little bit about the project. The project basically is about babies who are less than 7 days old being admitted to the acute pediatric service at Al Dahej Hospital. And these babies tend to have feeding problems. About 1/3 of the babies admitted were exclusively breastfed. And the issue here really is the fact that these babies you can avoid the admissions of these particular babies. It's just a feeding problem. By admitting them, you're exposing them to life-threatening infections, and also that has a whole impact on the NHS. The admissions itself has an impact on the economic side for the NHS. And also, by not being able to breastfeed, you are also, the mother and the child are losing out on the bonding. So the pediatricians want to understand why they are being admitted. Is it because they're not having good access to infant feeding support in their community? Also, they want to focus on where are these mothers coming from? Where do they live? Are they living in deprived areas? Are they of ethnic minority background as well? So for those who didn't get a chance to attend the last ARCFEST, we talked about our team, our Health and Care Across the Life course team, talked about dividing the theme into sub-themes. So we have 6 sub-themes: family and children, adolescents, working age adults, older adults, cross-generational, and marginalized groups. And listening to this particular project, we really felt that it would fit really well in family and children sub-themes. So it's a perfect fit for the Health and Care Across the Life course theme. Okay, so what are the next steps? So we've received the scoping form from the group, and we would like to connect them now with academics that have experience in this area, obviously research experience. And we'd also like to connect them with other member organizations that might have interest in this area. We'd also like to connect them with public advisors, people who have lived experience in this particular research topic. And we'd like them to help us inform the HIAT, which is a health inequalities assessment tool. We hope that this research, we're expecting that this research will have great potential in contributing to the design of future implementation strategies to address challenges with access to uptake of infant feeding support services, particularly those from deprived and ethnic minority groups. We hope that this particular group will be presenting at the ARCFEST next, which is next in September. So watch this space. Thank you very much.
Hello, I'm Alison Doty. I'm the theme manager for the Midas cross-cutting theme. The theme lead for Midas is Andy Clegg. Midas stands for Methodological Innovation Development, Adaptation and Support. We provide research methodological support for and the production of applied health and social care research, including the ARC North West Coast prioritisation projects. Just as a reminder, the ARC North West Coast supports research ideas via its prioritisation process. Members can submit ideas via the ARC North West Coast website or via an invitation to submit a pitch to the ARCFEST or by contacting one of the core themes directly. ARC staff then work with the people submitting ideas to help develop those ideas, and we use scoping forms and the Health Inequalities Assessment Toolkit to do this. If the idea is supported by the core theme, then the wider ARC membership is consulted via a prioritisation form that's circulated from our director and programme manager. If further support is required, then the core themes request support from the cross-cutting themes, which include Midas, Chai and Impact. Also to note that the ARC North West Coast is part of a wider NIHR infrastructure, and we've got links with other networks including other ARCs across the country, academic health science networks, the Research Design Service, Innovation Agency, to name but a few. We can also provide support in terms of public and patient involvement and engagement, and the development of research capacity and knowledge mobilisation. So, Midas, what kinds of support do we provide? Well, we provide methodological advice and guidance. We work closely with members to design and deliver co-produced research. We're developing new and adapting existing research methods, and we have expertise in evidence synthesis, including systematic reviews, information science, health economics and health informatics, qualitative and quantitative research, study design, trial support, and of course health inequalities and health equity. We're importantly developing a wider collaborative network of 11 different methodological subgroups to both develop and expand our methodological expertise and capacity. Also to note, health inequalities, co-production, capacity building, patient and public engagement and involvement are core principles which run throughout all of our work. So, some examples of our work. Well, we've co-produced a suite of COVID-19 related systematic reviews. And we did this on behalf of a formal request received from an ARC North West Coast member. We've co-produced 16 grant applications and 11 grants are being funded, totalling 1.28 million over the past 12 months. But probably the star of our show is our races projects. We've conducted 35 races since the start of the new ARC in November 2019. 16 of our races have been published or they're in press, and a further 19 races are ongoing. We've done these with and for ARC North West Coast members, including Lancashire Teaching Hospitals, Lancs and South Cumbria NHS Foundation Trust, East Lancs Hospital NHS Trust, and the University Hospital of Morecambe Bay NHS Foundation Trust. And the latest update is that we're now working with our Midas Public Advisor co-theme lead and deputy to co-produce some lay summaries of our races. So that was just a brief, very brief snapshot of some of our work. Do join us later this afternoon to find out more about our races and about our health equity mainstreaming strategy and action plan. Thank you for listening and enjoy your day.
Morning and welcome to ARCFEST. My name's Paula Wheeler and I'm the theme manager for the EPIC theme. My task in this session is to provide a quick example of how ARC staff and member organisations can coalesce around a research idea to generate plans for co-produced research projects and evaluations. For some of you today, attendance will offer the first glimpse into what the ARC programme is about, who does what, and information and insight into a number of different research projects. We have more than 60 member organisations and similar numbers of public advisors involved with our work. In addition, we have a community research and engagement network, sometimes referred to as the CORAN, and with strong VCFSE representation in addition to ARC staff and members of the public being involved, what that means is that there are loads of opportunities to collaborate and develop ideas for research that ultimately positively impact on our local system and our local communities. It is hopefully useful to know that in addition to ARCFEST, there are a number of ways that you're able to get engaged and be involved. We have regular communications disseminated to members, including our monthly emails at ARC Cascades. We have a number of bulletins. We also have the website, and that has lots of information about the different projects and ways of working that each of our themes have. In addition, we have a growing number of research networks and groups that you can also influence and contribute to. However, we shouldn't forget serendipity and chance conversations. They too have a role to play, and sometimes you're just in the right place at the right time. So, the project that I'm going to highlight includes colleagues from the EPIC theme, the Impact team, and colleagues from Active Lancashire, who are one of our member organisations. Following attendance at ARCFEST in December 2020 and regular contact via member engagement monthly emails, Active Lancashire was better able to understand how the ARC programme operates, the offer from the different themes, and how they could begin to coalesce ideas around our strong components around co-production, public involvement and collaboration. Initial conversations have centred on the work that Active Lancashire is supporting and how an applied research component might add value to the data and metrics currently reported on to increase the evidence base of what works. The impact team have convened an advisory group, and it's met several times since the start of the year to begin to co-produce a research project and research outline. The EPIC theme have been identified as potential research partners to support this proposal, and work is developing. Active Lancashire have been keen to explore how they might demonstrate the impact of the United Together project. The United Together project is a collaborative programme designed to demonstrate the positive effect that sport and physical activity has on the health of prison leavers. To gain an understanding of how the United Together project was delivered in partnership and the factors influencing its success, Active Lancashire has asked ARC North West Coast researchers to work with them to develop and design a short-term process evaluation. This has been drafted and an ethics application has been submitted. Subject to approval, we anticipate that work will begin in mid-July. Looking ahead, we're hoping that the findings will offer learning about the project's implementation and the partnership working involved, so that rollout will be effectively encouraged in other geographies. Data might also be used to contribute to other funding proposals in late autumn as we continue to build on the collaborations that we've got with Active Lancashire to develop longer-term research in this area. If you're interested in learning more about the project or want a conversation with ARC more generally and how we can support your organisation to deliver applied research, then please get in touch. Thank you.
Hello, my name is Dr. Pallavi Pandey and I am the manager for the person-centered complex care theme in the ARC Northwest Coast. Today I'm going to be talking to you about how a project came to the theme and how it has progressed so far, along with our support as a theme and support of the ARC Northwest Coast. The pain specialists from the Walton Centre actually approached us with a project revolving around complex regional pain syndrome. So the first thing we did is that we requested for a stage 1 scoping form to be completed. Now this scoping form has a series of questions, which you can see here. The first one is, what is the problem? What is the underlying uncertainty? What is the population group affected? What is the proposed project plan? What may influence implementation? What is the potential to reduce unfair differences in access and outcome? And what support from the ARC Northwest Coast is required? By looking at these answers from the applicants, we can sort of understand as a theme where exactly or what exactly is the next steps for this project to move forward, what is required, do they need more collaborators, and what sort of collaborators would be most likely be involved, and also would confirm to us that they are considering a health, or it does have a health inequalities aspect to the work, because that is one of the priorities of the ARC Northwest Coast. So let me just tell you a little bit about this project. It revolves around, like I said earlier, complex regional pain syndrome, and which is also known as CRPS. CRPS is a debilitating, painful condition in a limb which usually arises after injury, and the most common predisposing injury are distal radius fractures. And what the team has found out is that early movement and function of the limbs help reduce CRPS symptoms quite significantly. And what they would like to do is look at improving the management pathway for this condition, just basically to prevent the onset or CRPS from progressing into a really painful condition. So this project really seems extremely interesting to us. And because it had an implementation aspect to it, we decided to take it forward to the impact team. The impact team looks at implementation and helps identify support needed to take projects forward to implementation. Impact brought on the Midas team, which is within the ARC Northwest Coast, which gives methodological support, and also connected the pain specialists to the Lancashire CTU, as well as the RDS Northwest. And the idea was basically to think together and think what the best way of taking this project forward to implementation. So after a series of meetings between the different groups, it was decided that they would look at a project to implement an early intervention MDT model for the management of distal radius fracture within fracture clinics to reduce and prevent CRPS. They will be applying for funding and in particular the NIHR program grants for applied research, which the deadline is the end of July. I wish them all the very best. Thank you.
Thank you, everyone. I hope you found that really useful. So to find out more about how to pitch an idea to ARC Northwest Coast, please do visit our website or contact us directly by email. So thank you from me, and over to Selena.